So, today I am here to discuss a new lecture on National Mental Health Program. In this lecture, I will discuss about the mental health. After that, we will discuss about the objectives of National Mental Health Program and then what are the strategy under this program. Okay. So, let us start with the mental health. So, what is the scenario of this mental health? The data is showing nearly 6 to 7% of the population is suffering from mental disorder, and mental disorder means it could be anxiety, depression, yes, psychosis, okay, schizophrenia, all this, mood changes, mood behavior, okay, these all. And there are many reasons for it, okay, biological reason, there could be the stress, trauma, anything. So, this is showing this much percent. Now, what the World Bank report is saying? World Bank report in 1993 is revealing that the persons who are suffering from any mental disorder, they are also suffered from disability adjusted life year. Okay. So, yes, the quality of life is not that better, okay. It is with disability, yes. So, the disability adjusted life year loss due to neuropsychiatric disorder is much higher than patients with diarrhea, malaria, worm infections, tuberculosis, if you are taking it as individually. And if you will account all of diseases in the with the neuropsychiatric disorder, so what is the accountability? It is accounting nearly 12%. Okay. So, this is the point we should think of, government should think of, society should think of, okay, to reduce the global burden of the disease. Okay. So, they are making, means they are accounting nearly 12% and they are causing the global burden, and we have to think of so that we can make some plans for it. Okay. Now, another datas. So, 1 in 4 families is likely to have at least one member. Now, you can think of why this is a point of concern, okay, at least one member with a behavior or mental disorder. Okay. These families not only provide physical and emotional support, but they are also bearing the negative impact of the stigma in the society. Okay. So, in the society, mental disorders are taken as stigma or the discrimination. That is why they are not reported, okay, properly as it should be. So, most of them, more than 90% remain untreated, just because there is a one reason, this is taken as stigma or discrimination in the society, or most people are not familiar with it. Okay, they are not giving attention to their mental health. Okay. Poor awareness about the symptoms of the mental illness. Some are involved with myths, there is a stigma involved, there is a lack of proper knowledge on the treatment. Yes, if they are suffering from this type of behavior or mood changes, okay, or some of the symptoms of the mental illness, so they can get the treatment and they can be okay, they can be normal. So, this requires the proper knowledge, and there is a lack of knowledge, that is why they are less reported. Okay. And what are the other potential benefits of seeking treatment are important causes for the high treatment gap. Okay. So, this is one of the problem here we have seen, and after that we will discuss what are the programs. Okay. So, before the program discussion on the programs, National Mental Health Program, there is one chart. Okay. So, in this chart we can see my mental health, do I need help. Okay. So, first determine how much your symptoms interfere with daily life. I told you the people who are suffering from the mental disorders, they are suffering from they have disability adjusted life years, okay, they are losing their life years, okay, they are suffering with disability, they are not enjoying their life properly. Okay. So, see, do I have mild symptoms that have lasted for less than 2 weeks? You have to assess this. Okay. What you will see? Feeling a little down, feeling down but still able to do a job, schoolwork or homework, you will see all this. Okay. You are not able to sleep properly. Okay. Feeling down but still able to take care of yourself or care of others. So, you will analyze, yes, which type of symptoms you are suffering of. If so, what you will do? Here are some self care activities. What you will do? You will do exercise, you can also involve with some social contact. Okay. You can get a proper sleep, regular schedule you can make, healthy diets you can follow. Okay. Relaxation, you can relax yourself, you can take medication, mindfulness exercises. Okay. So, these type of some activities which are under the self care activities, okay, a person can do. After that, do I have severe? If a person is suffering from severe symptoms, so this is not going to help. Okay. What the patient will do? So, before this means the patient will go for the doctor, will first see what are the symptoms. So, there is a difficulty in sleeping, appetite changes that result in unwanted weight changes, okay, struggling to get out of the bed in the morning. So, these are some severe symptoms. You are not able to concentrate on your work. Okay. You have a loss of interest, you cannot perform your daily activities, you cannot think properly. Okay. These are some serious symptoms, and then what happen? What patient will do? They will seek the professional help. Okay. So, they can go for the psychotherapy, they can go for neurologist, they can take the help of them. After that, we have discussed what we have discussed previous is the mental health, and then we will see we have a program, National Mental Health Program, okay, NMHP. So, what is National Mental Health Program? The Government of India launched this program in 1982, okay, and there are some objectives. So, our objective is to ensure the availability and accessibility of minimum mental health care for all in the foreseeable future, particularly to the most vulnerable or unprivileged sections of the population. So, rural areas, rural section, okay, where the facilities are, where the PHC centers even are not available properly. Okay. So, our main goal is to provide the facilities, minimum, at least minimum facilities, okay, in these areas, okay, in the vulnerable areas or underprivileged sections. After that, another objective is to encourage the application of mental health knowledge in general health care. This is the main concern. Okay. In the previous slides, I also told you mental health is taken as a if any patient is reporting it, it is taken as stigma or discrimination towards the in between of the people. Okay. So, therefore, it is very important to spread the information or knowledge regarding this mental health in general healthcare or in social development. So, that if any person is suffering from any of the symptoms, they can go for the treatment, okay, without the concern of this social stigma or this fear in the society. Okay. To promote, next objective are to promote community participation in the mental health service development. So, community participation means, if you are seeing the community, means patients are involved, doctors are involved, okay, society is involved, means every individual, it is the responsibility of every individual, they are the part of the community to take that responsibility and participate in the mental health services development to stimulate the efforts towards the self help in the community. Okay. Without the community participation, we cannot implement our program successfully. Now, see the components of National Mental Health Program. So, under this we have designed the treatment of mentally ill, okay, and of course, in which category the patient is. The patient is suffering from anxiety, we will give the anti-anxiety drug. The patient is suffering from depression, we will give the antidepressant, or schizophrenia, we will give the antipsychotic drug, okay. And not only the drug, there are some counseling sessions as well, okay. We are providing some counseling sessions to the patients, and then the patient will be okay. Okay. Then after that, rehabilitation. If the patient is suffering from any trauma, okay, at that time we require the rehabilitation. Okay. So, this is also one of the component in NMHP. After that, prevention and promotion of positive mental health. How will promote it? So, for that we need campaigns, okay, campaigns for mental health. We need some camps facility, okay, some health camps, so some free health camps you can say, okay, they are more good to do. And of course, in the hospitals where we have the department for the mental health, the information regarding the mental health, it should be spreaded to all of the healthcare professionals as well as to the patient, okay, in a better way, so to prevent and promote it. After that, what are the strategies in the National Mental Health Program? So, see how we can make a plan to be successful. We will integrate mental health with primary health care, okay. Whenever we want our program to be successful, we have to start it from the local level, okay, local areas. So, in the local areas, if you will see the hierarchy of the health centers, it is started from PHC, primary health care, okay. After that, there are secondary health care, okay. Then there are tertiary health care, and there is some center of excellence, okay. Like in the mental health, we have center of excellence as NIMHANS, okay, National Institute for Mental Health Sciences. These are some of the institutes which are working as working so well, they are doing the research in these areas, okay, in mental sciences. After that, so this is, I told you, integration. So, we have integrated our program to a very local level PHC. Then after that, provision of tertiary care institutions, okay, tertiary care institution for treatment of mental disorders. Why tertiary care institutions? Because tertiary care institutions have all of the advanced facilities available for the treatment, okay. So, the tertiary care hospitals or institutions, they have the research facilities as well. So, we should have these institutions as well. After that, eradicating stigmatization of mentally ill patients, okay. The fear of reporting the mentally ill patients in this society. So, we have to eradicate it, zero discrimination, and protecting their rights through regulatory institutions, okay, like Central Mental Health Authority, State Mental Health Authority, okay. So, these are the strategies we have covered. After that, there is the District Mental Health Program, okay. District Mental Health Program, it is known as DMHP, okay. This program was launched in 1996, okay, under the NMHP, National Mental Health Program. So, this District Mental Health Program, it is based on a very famous model, Bellary model, okay. What Bellary model is saying? See, there are some components. So, in District Mental Health Program, what we will do? identify the case, okay, as early as possible and treat it. Training of the personal healthcare staffs. So, for this we need short term training programs or long term training programs also. So, for short term training programs to general physicians for the diagnosis, for the treatment, for the testing facilities, okay, of common mental illnesses with limited number of drugs. Okay, how we can reduce the side effects. So, limited number of drugs means we are prescribing the drugs, the physicians are prescribing the drugs, but before this there are some other things, non-pharmacological measures also we can use. So, to reduce the stress, how to reduce the stress, maintain healthy diets, maintain exercise, do daily exercise. Okay. So, these are some of the non-pharmacological measures also can be used. That is why written limited number of drugs under the guidance of specialist. Counseling sessions are also part in it. Okay. Then in district mental health program, the health workers are being trained in identifying mentally ill persons. For this there are training. Okay. So, health workers, pharmacists, nurses, okay, and we have social activist, social health activist. Okay. So, we are providing the training to them also under the NMHP. IEC. So, for all of the programs I have discussed this term IEC, information, education, communication, okay, providing the public awareness. Monitoring, the purpose is for simple record keeping. Without the record we are not able to get, yes, the programs are going good or not, what are the corrections we have to we have to do for the next. Okay. After that we have a PPP model activities. Okay. In any of the program we need the partnership. Okay. So, public private partnership model activities. Without the collaboration at national level, international levels, it is difficult to implement it. Okay. So, PPP model activities, the financial support is 5 lakh per NGO, okay, non-government organization. So, under this component there is a provision for the state governments to execute activities which are related with the mental health. So, for the campaigns, for implementing it on the primary health care levels, we are providing the funds in partnership with non-governmental organization agencies at district level, at state level. Okay. After that there are some daycare center. So, daycare center, they are providing, these centers are providing help, support to the patients, mentally ill patients. So, financial funding, if you will see, the financial support is given at the rate of 50,000 per center per month. Okay. What facilities the daycare centers are providing for the mentally ill patients? See, they are providing rehabilitation, they are providing recovery services to the persons, okay, so that initial intervention with a drug or psychotherapy is followed up and the relapse of the infection, relapse of the condition is prevented. Okay. After that, what are the other services? They are enhancing the skills of the family or caregiver, so that the family members are also involved in helping the patient. Okay. So, this is very important here. After that, they are also providing, these DK centers are also providing opportunity for the people recovering from mental illness for successful community living. Of course, their quality of life will be improved, yes. So, they can successfully live in the community, yes. After that, the financial support of rupees 6 lakhs is earmarked per center per year. Okay. So, this is the financial means what are the funds they will receive. As I told you, there are some daycare centers for the mentally ill patients which are providing the facilities to the mentally ill patients, okay, in diagnostic as well as for treating. Similarly, we have some residential facilities, okay, residential or long term continuing care center. With the name you are very clear. In this, the patients who are chronically ill, okay, they are getting the help. So, we will see the financial support. The financial support is 75,000 per center per month. Okay. So, chronically mentally ill patients are provided help here, who have achieved stability with respect to their symptoms and have not been able to return to their families. So, for them these centers will keep them, these centers will keep those patients chronically mentally ill and provide the healthcare facilities to them. Okay. Residential patients in these centers will go through a structured program, okay, which will be executed with the help of multidisciplinary team. Multidisciplinary means all of the healthcare professionals, consisting of psychologists, I told you, social workers, nurses, occupational therapists, okay, vocational trainers and support staff. So, many of the these group of people, they are working as a multidisciplinary team and they are helping these patients. Okay. Financial support per year, if you will see, it is nearly 9 lakh. Okay. So, these are some of the terms under the National Mental Health Program. After that, see the primary health centers. In the primary health centers, which are in lower hierarchy, if you will see, if you will see the levels of the centers. So, you will find primary healthcare centers are lower in hierarchy, then after that secondary healthcare centers and tertiary healthcare centers, and there are some center of excellence. So, in PHC, what are the services available? Okay. In primary healthcare centers, outpatient services are available. So, any patient who is suffering from the symptom, they can come to the OPD. Okay. They can take the prescription and after the consultation, they will get the medication. So, this is the outpatient services. Counseling services, there are doctors available, they are providing counseling services in assessing social care benefits. And primary healthcare centers are also doing the proactive case findings. Okay. They are seeing the cases so that they can prevent the disease on the early stages. Okay. Who is the manpower? So, community health workers are working. Okay. Now, community health centers. After the primary health centers, as I told you in the previous slide, if you will see on the above hierarchy, you will see after the primary health care centers, we have community health centers, CHC. What are the services available? The same services are available, but there are some more facilities compared to the PHC. So, outpatient services are there, any patient can come and take consultation, go to home. In the CHC, you will see there are inpatient services as well. Inpatient services means the patients who are not able to take care of themselves at home. So, they can come to hospital and hospitalized. Okay. They can take the facilities from the hospital. So, they are inpatient services. For emergency psychiatry patients, counseling services are available. Who is working in the community health centers? So, medical officers are seeing this, and clinical psychologists are here, psychiatric social worker are there, okay, for seeing the mental patient. Now, see tertiary level activities. Okay. Tertiary level activities, previously also I told you, tertiary level activities or tertiary level institutions who are giving these facilities, they are more advanced. Okay. They have all of the facilities, advanced facilities are available for diagnostic, for treatment. So, in the tertiary level activities under the National Mental Health Program, we need to improve. Okay. According to the program, there should be the upgradation of existing mental hospitals, institutes, medical colleges will take in up to start or strengthen the courses, especially in these areas, these mental sciences. So, psychiatry, clinical psychology, psychiatric social work, psychiatric nursing, okay, and also some other specialized branches in them. Then government medical colleges or government mental hospitals will be supported for starting or increasing intake of PG courses. So, main concern is given here as teaching or research. Okay. In the tertiary level activities which are provided by the tertiary healthcare centers. Now, coming to the training of trainers. So, trainers means the training of the social workers, nurses, pharmacists. This is required to implement our program. So, what will this specifically relates to understanding of health and welfare infrastructure in the country, and what are the aspects of mental health planning like choice of support and supervisory work. Okay. What are the centers which are providing the training? So, see, the first was organized by ICMR, New Delhi in 1981, and after that there are some other training centers as well which are providing training. So, NIMHANS is providing training. Then apart from it we have AIIMS, we have PGI. Okay. So, these of the institutions are working and providing the training to the healthcare professionals. Okay. Currently, support for this training is available from the WHO, country and country fund, as well as from the ICMR New Delhi. Okay. And the Advanced Care Center for Research on Community Mental Health is present at NIMHANS. Okay. National Institute of Mental Health Sciences in Bangalore. Okay. So, thank you so much everyone. I hope this is clear to all of you. We will meet in the next session.